What is the most common cause of primary hyperparathyroidism? A. Parathyroid hyperplasia. B. Parathyroid carcinoma. C. Parathyroid adenoma. D. None of these. The answer is C. Parathyroid adenoma. Primary hyperparathyroidism is most commonly due to a parathyroid adenoma. 80 to 90% of cases of primary hyperparathyroidism are due to parathyroid adenoma. 10 to 15% cases are due to parathyroid hyperplasia, and parathyroid carcinoma accounts for 1 to 5% of all cases. Secondary hyperparathyroidism is the result of chronically diminished levels of serum calcium. Depressed levels of serum calcium leads to a compensatory increase in the activity of the parathyroid glands. What is the most common cause of secondary hyperparathyroidism? A. Poor nutrition. B. Renal failure. C. Bone cancers. D. Pituitary tumor. The answer is B. Renal failure. Renal failure is by far the most common cause of secondary hyperparathyroidism. If kidneys are unable to convert vitamin D to its active form, serum vitamin D levels will drop. Lower vitamin D levels reduce the absorption of calcium in the intestines and reduce the kidney's ability to resorb calcium from the urine. In addition, if the kidneys are unable to adequately excrete phosphate, calcium phosphate forms, which further lowers free calcium levels in the blood. Poor nutrition is not a common cause of secondary hyperparathyroidism, though low vitamin D levels due to malabsorption can be a contributing factor. Pituitary tumors can be seen with hyperparathyroidism when part of multiple endocrine neoplasia type I, but this is not as common as renal failure. Bone cancers are more often associated with elevated calcium levels, resulting in low or undetectable parathyroid hormone levels. A 50-year-old female client is seen in the clinic for her recent diagnosis of hypothyroidism. Which of the following instructions should be included in the nurse's teaching plan? A. Explain the outcomes expected with removal of the thyroid gland. B. High protein, low carbohydrate diet and replacement hydrocortisone. C. Obtain a hemoglobin A1C test. D. The use of antiglycemic medications. E. High fiber, low calorie diet, and 5 to 6 small meals per day. The answer is E. High fiber, low calorie diet, and 5 to 6 small meals per day. Hypothyroidism usually involves weight gain, so a lower calorie diet with frequent small meals are recommended. High fiber, low calorie diets and stool softeners will help to alleviate these symptoms. Antiglycemics and hemoglobin A1C tests are indicated for diabetics. A middle-aged female client has just underwent a thyroidectomy for treatment of Graves' disease. The nurse caring for this client is aware she may need to monitor the client for what possible complication? A. Bone pain. B. Goiter. C. Oliguria. D. Tetany. E. Tetanus. The answer is D. Tetany. Tetany is a complication due to hypocalcemia which can occur if the parathyroid glands which control calcium balance are accidentally injured during thyroidectomy. Tetany is associated with nerve excitability and sustained muscle contractions, or spasms. Tetanus, bone pain, and oliguria are not associated with complications of a thyroidectomy. Goiter is a manifestation of an overactive thyroid. A 45-year-old female client with Addison's disease has presented to the client for instruction on her medication regimen. The nurse understands that the patient may require lifelong corticosteroid replacement. It will be necessary to educate the client about possible side effects of this type of therapy. Which of the following should a nurse include in her teaching plan about corticosteroid therapy? A. Monitor glucose with finger sticks to check for hypoglycemia. B. Increase sodium intake to prevent hypotension due to edema. C. Increase calcium intake to at least 1,500 mg per day with vitamin D, to help to prevent steroid-induced osteoporosis. D. The medications should be taken on an empty stomach in the morning to avoid nausea if taken with food. E. Increase intake of folic acid and B12 to prevent neurological side effects such as paresthesias of the hands and feet. The answer is C. Increase calcium intake to at least 1,500 mg per day with vitamin D, to help to prevent steroid-induced osteoporosis. Corticosteroids may lead to bone loss, especially after long-term treatment, over 3 months. Calcium and vitamin D supplementation can help prevent these side effects. The client should also be advised to start a low-impact exercise regimen if possible, and if necessary take a bisphosphonate drug. You are caring for a patient who is started on clindamycin, ketorolac, prednisone, lisinopril, and simvastatin. After receiving multiple doses of each of these medications, you notice that the patient's blood glucose is 205 mg per deciliter. Which of these medications is known to cause hyperglycemia? A. Ketorolac. B. Lisinopril. C. Simvastatin. D. Prednisone. E. Clindamycin. The answer is D. Prednisone. Of all the medications listed, prednisone is the only medication that is known to cause hyperglycemia. Prednisone has a number of side effects including hyperglycemia, acne, headache, restlessness, insomnia, nausea, vomiting, and weight gain, among others. Clindamycin's side effects include diarrhea, including Clostridium difficile, and less commonly nausea, vomiting, and abdominal pain, among others, but not hyperglycemia. Ketorolac's side effects include renal toxicity, tinnitus, heartburn, diarrhea, and abdominal pain, among others, but not hyperglycemia. Lisinopril's side effects include hypotension, lightheadedness, angioedema, and barky cough, among others, but not hyperglycemia. Simvastatin's side effects include muscle pains, aches, muscle weakness, and less frequently confusion, and electrolyte disturbances, but not hyperglycemia. You are the nurse taking care of a patient with type 2 diabetes mellitus. The patient is hospitalized for pneumonia and switched from his home medication, metformin, to sliding scale insulin, while inpatient. You explain to the patient that the specific reason is which of the following? A. To prevent lactic acidosis while hospitalized. B. To prevent headache while hospitalized. C. To prevent myocardial infarction while hospitalized. D. To prevent depression while hospitalized. E. To prevent stroke while hospitalized. The answer is A. To prevent lactic acidosis while hospitalized. A known side effect of metformin use is development of lactic acidosis, a form of metabolic acidosis. Patients who are hospitalized, especially if hospitalized for infections, like pneumonia, are independently at an elevated risk of developing a lactic acidosis. As such, to minimize the risk of lactic acidosis, a modifiable risk factor, metformin use, is frequently temporarily discontinued while inpatient. Patients on metformin are frequently switched to sliding scale insulin as inpatients, as this allows for adequate glycemic monitoring, titration, and control. Once they are stable for discharge and the cause of their hospitalization is addressed and treated, most can be safely discharged home on metformin without issue. While numerous measures are carried out while patients are hospitalized to prevent myocardial infarction, stroke, headache, and depression, the switching of metformin to sliding scale insulin is not performed specifically for any of those reasons. Which of the following is true of type 1 diabetes? A. Patients develop insulin resistance. B. Patients are typically overweight adults. C. Patients typically present in diabetic ketoacidosis. D. Patients do not require treatment with insulin. The answer is C. Patients typically present in diabetic ketoacidosis. Type 1 diabetes is an autoimmune process that typically presents in young children in the form of DKA, diabetic ketoacidosis. This potentially life-threatening condition is treated with IV insulin. Type 2 diabetes is insulin resistance, and is found in older adults, typically those who are overweight. The nurse is caring for a patient who is to receive a fasting blood glucose test. The nurse does all of the following to prepare the patient except dash. A. Restricts meals 4 to 8 hours before the test. B. Marks the patient in PO 2 hours before the test. C. Instructs the patient to refrain from the use of hard candy. D. Instructs the patient not to use any gum or breath mints. E. Stops the patient's D5 0.45 IV maintenance fluid. The answer is B. Marks the patient in PO 2 hours before the test. The patient should refrain from ingesting any material that may contain sugar prior to a fasting blood glucose. However, is not necessary for a patient to be labeled in PO as they are still able to ingest water. All other preparations should be made. The nurse cares for a patient newly diagnosed with systemic lupus erythematosus, SLE. Which of the following is a characteristic sign of SLE? A. Pain during exposure to cold. B. Blood in urine. C. Arthritis and joint swelling. D. Lesions on extremities. E. Butterfly rash across bridge of nose and cheeks. The answer is E. Butterfly rash across bridge of nose and cheeks. The most characteristic sign of SLE is a butterfly rash across the bridge of nose and cheeks. The others listed are also signs and symptoms of SLE, but the most well-known sign that is specific to SLE is the butterfly rash. Arthritis and joint swelling, hematuria, lesions on extremities, and pain during exposure to cold, Raynaud's phenomenon, may be signs of other diseases.